In our today's lecture, we will discuss about the blood supply to the head and neck. We have already discussed about the aorta, its parts and its branches, and we know that three major vessels arise from the arch of aorta. Starting from the right, the brachiosphaeric trunk, the left common carotid artery, and the left subclavian artery. The right common carotid and right subclavian arteries arise from the brachiosphaeric trunk. So basically, the arteries taking part in the circulation of head and neck are two vertebral and two carotid arteries. We will discuss these arteries individually. Let's talk about the carotid arteries first. As I have already said, we know that these are the paired branches, the one arising from the right and the other from the left. The right from the brachiosphaeric trunk and the left from the arch of aorta, directly arising from the arch of aorta. Uh, these arteries, if we talk about its course, after arising from their sides, run upwards behind the sternoclavicular joint in front of the trachea, enclosed in the carotid sheath. Now, what is the carotid sheath? Carotid sheath is basically the fibrous connective tissue that surrounds the vascular compartment of the neck and is a part of the deep cervical fascia of the neck. And deep fascia, you already know that lies immediately beneath the skin, the layer that is also known as the subcutaneous adipose tissue. At the upper border of the thyroid cartilage, which is approximately the level of C4 vertebra, the common carotid artery bifurcates into internal and external carotid branches. And at its bifurcation, we find some structures at this level. The first structure is carotid sinus. At the termination of common carotid artery and the beginning of internal carotid artery, there are present dilations in the wall of the artery, and the carotid sinus where it is present, and the wall is much thinner and more elastic than the other parts of the artery. These walls of the sinuses contain numerous nerve endings of the glossopharyngeal nerve, which is one of the cranial nerve we will discuss later. These nerve endings are very sensitive to the pressure changes in the arterial blood and act as a baroreceptor. Baroreceptors are the receptors that respond to the changes in the pressure. Uh, and how do they adapt to this change? They regulates the blood pressure. The second structure that we find is carotid body, and it is a small oval shaped neurovascular structure located just behind the bifurcation of the common carotid artery close to the carotid sinus. And the carotid body acts as a chemoreceptor. Chemoreceptor are receptors that monitor change in the blood oxygen and pH. And how do they respond? They respond to these changes by changing the heart rate, breathing, and also the blood pressure. Now, if we talk about the carotid body, stimulation of carotid body due to decreased content of oxygen produces a rise in blood pressure and heart rate, and changes in the rate of respiration, and these adjustment are in respiratory center located in the medulla, made through the nerve impulses. uh, you can see in this image there are two sections, the one showing the interior view and the other showing the lateral view of the common carotid artery. In the interior view, on the left, you can see the course, the origin, and the bifurcation of the common carotid arteries. You can see that the right and left common carotid arteries are originating from their sides. The right from the brachiosphaeric trunk, and the left from the arch of aorta. And if you look at its course, these are going upwards in front of the trachea, enclosed in the carotid sheath, and at the level of the thyroid cartilage, or at the level of upper border of the thyroid cartilage. The common carotid arteries are bifurcating into its main branches, internal carotid and external carotid arteries. If you look at the lateral section of this image, you can see the carotid sinus that I have already discussed, that these are the dilations in the artery. The wall here will be much thinner and more elastic, and these are sensitive to the pressure changes. Now let's talk about the vertebral arteries. Vertebral arteries are basically the branches of subclavian arteries, and these are paired branches. The one coming from the right subclavian and the other from the left subclavian artery. And if we talk about its course, after rising from the subclavian arteries, it's going posteriorly and traveling between the foramen. These foramen are present in the transverse processes of the cervical vertebra, and these foramen are called the vertebral artery foramens. And these vertebral arteries taking part in the formation of circulus arteriosus, which we will discuss later. The next image is showing the pulse site for the carotid artery, which is you can see a muscle belly here, and this muscle is called the sternocleidomastoid muscle. And carotid artery is present medial to this muscle belly. Now the branches of common carotid artery. We have already taken an overview of common carotid artery and its branches, and now we will discuss these branches individually. So first, which I am going to tell you about, is external carotid artery. This artery supplies the superficial tissues of the head and neck via a number of branches. Before that, remember that external carotid artery travels superficially and supplies the superficial structures lying in the head and neck area, while the internal carotid artery goes inside of the brain or interior to the cranial cavity and takes part in the formation of circulus arteriosus. External carotid artery is a high resistant vessel and internal carotid artery is a low resistant vessel. So if we talk about the branches of external carotid artery, it has 8 main branches named as superior thyroid, lingual, facial, occipital, temporal, maxillary, posterior auricular, and ascending pharyngeal arteries. As the name presents, the superior thyroid artery will supply the thyroid gland and adjacent muscles. The lingual artery will supply the tongue, the membrane that lines the mouth, the structures in the floor of the mouth, the tonsils, and the epiglottis. The facial artery, it passes outwards over the mandible just in front of the angle of the jaw and supplies the muscles of facial expression and structures in the mouth. At the angle of jaw, you can feel its pulsation. The occipital artery supplies the posterior part of the scalp. The temporal artery, it passes upwards over the zygomatic process, the process of your cheekbone, in front of the ear, and supplies the frontal, temporal, and parietal parts of the scalp. The temporal pulse, it can be felt in front of the upper part of the ear. The maxillary artery that supplies the muscles of mastication, and these are the muscle that help in chewing the food. And a branch of this artery is the middle meningeal artery, which runs deeply to supply structures in the interior of the skull. You can see in this image the various branches of the external carotid artery. There is a mnemonic as well for you to remember the branches of external carotid artery easily. In this image, you can see the pulsation or the location for the pulsation of facial and superficial temporal arteries. The one showing in the A image is facial artery, and this is the position of angle of jaw where you can feel the facial artery pulse. On the image represented as B, you can feel the superficial temporal artery, which is in front of the ear. Okay, now internal carotid artery. Internal carotid artery is a major contributor to the circulus arteriosus or circulovillus. If we talk about its course, we have already discussed about its origin. We know that it its origin is after the bifurcation of common carotid artery at the level of the upper border of thyroid cartilage. The internal carotid artery, after its origin, runs upward, and it passes through the carotid canal or carotid foramen present in the temporal bone. And once it passes through the foramen, carotid foramen, it goes inside the cranial cavity and takes part in the formation of circulus arteriosus. 80% of the blood supply to the brain is through the internal carotid artery, and this is a low resistant vessel, I have already told you. It gives many branches, and these branches supply the blood to the brain and the forehead, nose, and eye. In this image, you can see some of its branches named as anterior cerebral artery, middle cerebral artery highlighted in green, and ophthalmic artery highlighted in yellow. Ophthalmic artery gives off a branch to the eye, which is the central retinal artery, and it is a very good example of endarteries, meaning there is no collateral or no estemosis present. And if this artery is occluded, the person will be unable to see. Okay, now moving on to the very important topic, which is circulus arteriosus. uh, there are different names for circle of Willis. We can also call it circulus arteriosus or polygon of Willis. Why polygon? Because it makes a shape of polygon. Okay, so the greater part of the brain is supplied by the arterial blood by an arrangement of arteries called the circulus arteriosus or the circle of Willis. We can see that the circle of Willis is formed by the two interconnecting arterial sources, or we can say that there are two important systems involved in the formation of circle of Willis. The one system is formed by the internal carotid arteries, and the other system is formed by the vertebro-basilar system. As the name says, the vertebro-basilar system is formed by the two vertebral arteries and the basilar arteries. This anastomosis is an anterior-posterior order with the source with the anterior source from internal carotid artery and their branches, and the posterior source from the vertebral arteries and their branches. So we are basically dividing the brain into the interior and posterior parts, and we are saying that the interior part has its own source, which is anterior source, and is supplied by the internal carotid arteries and its branches, and the posterior part of the brain has its own source, which is posterior source, and the posterior source is supplied by the vertebral arteries and the basilar artery, and we are calling this system as the vertebro-basilar system. So if you look at this image, you can see in this image below the two vertebral arteries coming into the brain, and these two branches are forming a single vessel known as the basilar artery. So if we talk about the posterior source and anterior source individually, the posterior source basically supplies the cerebellum, brainstem, and the posterior aspects of the cerebral hemispheres. At the lower border of the pons, which is also the part of brainstem, it forms a single artery which is called the basilar artery. You can clearly see in this image. If you look at the next image, we can see the levels. The posterior source, which is from the vertebral arteries and the basilar artery, it is supplying the cerebellum, brainstem, and the posterior aspects of the cerebral hemispheres. And at the lower border of the bones, the two vertebral arteries are joining to form the single basilar artery. Okay, so uh, the vertebral arteries give off many branches which somewhat run downwards, and these branches are the posterior inferior cerebral arteries, the interior spinal arteries, and posterior spinal artery. You can see in this image, you can see uh, the branches of vertebral arteries, the interior inferior cerebral and the posterior inferior cerebral arteries. The posterior inferior cerebral artery is a branch of the vertebral artery, not the interior inferior cerebral. This is the branch of basilar artery. The interior and posterior spinal arteries are not mentioned here. Okay, then the basilar artery runs upwards in the midline, giving off various branches. The short branches that you can see are the five short branches. These are the pontine branches. Superior cerebral and interior inferior cerebral arteries are also the branches of basilar arteries. The important branches of basilar arteries that are taking part in the circulus arteriosus are its terminating branches named as posterior cerebral arteries, which are highlighted in orange. Okay, so this is the posterior source of the blood supply to the brain, and I would like to repeat it. You can see in this image the vertebral arteries coming from both sides, the right from the right part and the left from the left, and we have already discussed about its course. We know that the vertebral arteries, after rising from the subclavian arteries, are traveling in the vertebral foramen present in the transverse processes of the cervical vertebrae, running upwards and entering into the brain, and they both join to form a single artery which is known as the basilar artery. If we talk about the branches of vertebral artery, you can see in this figure the posterior inferior cerebral artery is a branch of vertebral artery. Also the interior and posterior spinal arteries. The basilar artery also gives off many branches. The five short vessels or arteries are named as the pontine branches. The superior cerebral artery is also the branch of basilar artery, and the most important terminal branches of basilar artery are the posterior cerebral arteries, taking part in the formation of circulus arteriosus. Now we will talk about the interior source of the brain, or the circular village.